Hello, I'm Jane Taylor. I'm an improvement advisor for the Institute for Healthcare Improvement. I'm here today to share with you, fellows in the Hospital Engagement Network, a technique for having a great meeting. This is called the 7-step meeting process, and I first learned it in the late 80s from the Executive Learning Institute in Nashville, Tennessee. So let me begin by sharing with you this example of using a PDSA cycle to have a great meeting. So in a PDSA cycle, we plan, we do, we study, we act. And a 7-step meeting process is very similar to that. We're going to plan our meeting, we're going to do our meeting, and then we're going to evaluate our meeting. So I'd like to go through the steps. The first step is review the objective of the meeting right before you start. Then review the roles, and we suggest 4 roles in this meeting process. The first role, and these roles are rotated by the way, is a leader, a recorder, a timekeeper, and a facilitator if facilitation is needed or just-in-time training of quality improvement tools. So we review who's doing what for the meeting so we remember, and also we're going to give the timekeeper some instructions when to give us warnings. So if we have half our time is used up on an agenda item and maybe a 1-minute warning. So the timekeeper really helps us stay on time. The facilitator helps us stick to the knitting and stick to our process, and the leader really is convening the meeting, and the recorder is keeping the notes. Then we review our agenda because maybe we've got some changes and we need to adjust our agenda. The 4th step is actually working through the agenda. That's the key part of the meeting. That's the meat of the meeting. Then we review the meeting record from what the recorder has been recording. We plan our next steps, what needs to happen between now and when we meet again. And we actually plan our agenda together before we leave. So we're planning our next agenda. And then the final step, the 7th step, is evaluating the meeting so that the meeting becomes a way of learning how to get better at doing meetings. So you see we have a plan, we do the meeting, we decide what we're going to do next, and we evaluate how we did. So it's very similar to a PDSA cycle. I'd like to show you an example of how this might look. So the date is the 23rd of September. That actually is today. We're in conference room A. Our meeting starts at 10 o'clock, and we are the blue team. The objective of our meeting, because we're going to spend, by the way, we've put some times here of how much time we want to spend on each agenda item because we only have an hour. So we're going to spend 1 minute reviewing the objective of our meeting. This meeting, our objective is to review the last 3 PDSA cycles that we did for Always Use Teach Back. And we want to plan our next steps in our next PDSA cycles. That's what we want to get done in this meeting. Then we review the roles, and today I'm leading. Hosea is now recording. Wanda is doing the timekeeping, and the facilitator is Lou. And you can see that I've abbreviated LRT and F just to save space. We're going to review the agenda, and that'll take a minute. And as I review the agenda, I see we have 3 agenda items. We're going to review the Teach Back PDSAs for medication adherence and patient know-how, building patient know-how. Then we're going to review the PDSA cycle on Teach Back for when is the best time in the hospital stay to begin Teach Back. And then the 3rd PDSA cycle we want to review are signs and symptoms so that patients know when they should call their provider. Then we'll spend 30 minutes on those items, probably about 10 minutes each PDSA cycle. Then we'll spend 5 minutes reviewing our meeting record. And by the way, this is when we approve our minutes. So we don't go through that part of Robert's Rule of Order. Next time we meet, we're going to review our meeting record today and say, yep, this is what we did, that's good enough. Then we plan our next agenda, and more importantly, our next PDSA cycles. Make sure those are teed up, and then we evaluate our meetings so that we can learn how to have better meetings. I'd like to share with you what a meeting evaluation might look like. The technique that I favor is to go round robin. Each person and the team says one thing that went well, and always start with the went wells. And the reason that we go round robin is that if the first person is allowed to give their entire list of went wells, maybe no one else has a contribution to offer. So we're going to go around the table, around the meeting area until every person is done contributing. And so an example of what went well in this meeting is we stayed on time. So our time planning was well done. We spent enough time on the study phases of the PDSA cycles that we really were able to learn and plan our next cycles. So we articulated the learning that we learned from PDSA, and then finally the cycles are run in between our meetings, and that was very helpful to make this meeting productive. What could we do better next time? Well, we decided that it would be really helpful if we always open our meetings with looking at our data, looking at the run charts of our outcome, process, and balancing measures. So that's something that we're going to add next time we meet. We want to invite pharmacy to come to our next meeting because, after all, we're talking about medication adherence and signs and symptoms. So we think that they could make a valuable addition to our team. And we want to think about how we might engage office practices in working on this important project to always use TeachBack. I just reviewed what a meeting evaluation might look like, which is the final step in the 7-step meeting process. And now I want to show you an example of what it looks like to plan the next steps and the next agenda item. So we planned our meeting in September, late September. We planned our next meeting agenda for the 5th of October. And we are the blue team. We're going to meet at 10 a.m., but next time we're going to meet in conference room C. The objective of that meeting is going to be to review the 3 PDSA cycles that we teed up last time and to learn more about the half-life of TeachBack. That is, how long does TeachBack last for patients after they're discharged from the hospital? Because we're trying to always use TeachBack. So this time, the roles have changed because everybody gets a chance in this technique to be the leader of a meeting, and everyone shares the burden of recording and timekeeping and facilitating. So this time Wanda's going to lead, I'm going to keep time, Lou is going to record, and Hosea is going to facilitate. So we review the agenda, and we see we have 30 minutes, and we're going to remember we noted that we wanted to start working on opening our meeting agenda with looking at data. So now we've added that. We're going to review data, run chart data of our outcome, process, and balancing measures. That's how we're going to start our meeting. Then we're going to report out our 3 PDSA cycles, which are the next iteration of our cycles. And the new thing we're adding to our agenda is we want to learn from our post-discharge phone calls that we're making to patients to see what can they teach back after they get home. And that's an important piece of information for the team so that the team knows where some of their teach-back failures might be, and they can help improve and strengthen the teach-back before patients are discharged. And we want to now surface systemic barriers that might need to be overcome to further implement our program, so we're going to refer those to leadership. So that's our agenda. We review our meeting record after we've had our meeting. Again, we plan our next steps in our agenda, and then we evaluate how this meeting went. So this is the 7-step meeting process. It will help you stay on time. It will help you have really productive meetings. I highly recommend that you give it a go. Thank you.